Happy New Year! We are kicking off 2022 with some new social media. 4NP's podcast is now available on YouTube. And if you're in the mood for some fun and some quick info, check out our TikTok. We have also added a Facebook group called Nurse Business for positivity, support, inspiration, and to grow our community. Shout out to Bella Friedman. She's our wonderful new media manager, and we are so thrilled to be working with her.
We are Christina,
Oneida,
Alicia, Colleen.
Welcome to 4NP's podcast.
This is a podcast by 4NPs. 4NPs, advanced practice nurses, students, and anyone interested in the medical arts.
That's the number 4 NPS podcast.
if you have a topic you'd like to see covered, please feel free to email us at 4npspodcast@gmail.com or reach out to us through our social media.
Today's episode will inspire you for sure. Our guest has been a mentor to all of us, Dr. Elaine Suderio-Tirone. Elaine is a DNP and family nurse practitioner who is currently back in school for her Psych NP. Elaine is that nurse you meet that truly does it all and does it well. She is a pediatric hospitalist at an academic medical center, a college professor, a preceptor, and mentor. Elaine has also spent years in the specialty of ENT, allergy, and facial plastics. Not only is Elaine a wonderful, experienced nurse practitioner, she is very driven and so passionate about teaching and sharing her knowledge with other nurses. She is the founder and medical director of New York Aesthetics Med Spa Consulting and Training, located in Mahopac, New York. If you are an RN or NP and want your certification for Botox and fillers, Elaine is the one to call. If you just want Botox and fillers for yourself, the information is on this episode and in our show notes. As if being a DNP, NP, and NP student wasn't enough, Elaine is also a mom and an artist, and in her spare time, she volunteers with the Cystic Fibrosis Foundation and Healing the Children. She also travels all over the world to provide free medical care. Get ready to be inspired. 2022 is going to be great. Welcome, Dr. Elaine Suderio-Tirone. We are so thrilled to have you join us today.
Thank you so much for having me. This is really exciting. I'm very excited to see you guys and what you're doing. I think it's very important that you put this together for our nurses and just NPs in the community. Kudos to you. So my name is Elaine Suderio-Tirone. I am a family nurse practitioner doing a lot of stuff, and I think we'll get into that later on, but definitely trying to touch into areas of interest personally for me, and I love all of them. So I'm a professor in Mount St. Mary College. I'm a hospitalist. I do cosmetics. I do ENT allergy, and a whole lot of things, but we can talk about that as we move on tonight.
Yeah. So what made you, first of all, I guess, get into nursing, and then what has your journey been to each of these places, I guess? Like, what drives you, I guess, is a question.
Okay. So I always want to learn something new. That's just me. I don't sit around. I love being in school. I love being a student. And through the years, I saw how nursing, as well as the trajectory of healthcare in general, was evolving. I realized that as a nurse, I can always do something more, advance my studies, and explore new options for nurses with advanced practice. So I wanted to, as a nurse, I always wanted to be able to decipher what actually is going on with my patients, diagnose them, and formulate a management plan specific to their medical needs. But we're so used to just reporting everything that we have assessed to the doctors. But for me at that point, I was like, I can always advance my studies. I can do that myself autonomously. So that really drove me to go for my advanced studies. The journey itself was not particularly easy, as you all know, especially if you are working full-time and try to fit in all the clinical hours, 600 of them, and study for the exams and just study the materials. It is a lot. But in order to accomplish my goal to get to my advanced degree, I had to make time. I used to wake up at 6 o'clock in the morning and go to work, but once I was in school, I would wake up at 4:30 in the morning to make time to study all the school materials. You just have to really make it work, because people usually say, how do you have time? It's so easy to say, I have no time.
Yeah.
But in order for you to accomplish something, you have to make that time.
I agree.
Yeah. It's not easy, but you got to do it, right?
Yeah, exactly. And for me, especially as a nurse practitioner, I wear multiple hats. First, I work as a pediatric hospitalist and has been doing that for 11 years. I also work in the outpatient setting in ENT, allergy, and plastics, seeing different kinds of ENT and cosmetic problems. I've been doing that since 2010. And then third, I work as a full-time professor in the graduate program of School of Nursing in Mount St. Mary College, where I all met you. Mm-hmm. And you were just all amazing students. And it was really a privilege and an honor to meet you guys. And lastly, I own my practice in aesthetics. I teach clinicians who wants to learn various procedures in facial aesthetics. And I also provide various treatments in different medical spas in the area.
Oh. What is your business called?
New York Aesthetics is right here. Consulting and training.
Great. And if people are interested in getting in contact with you, how do they contact you?
I have 845-242-5514. That's our number. I also have a website. It's newyorkaesthetics.training.org.
All right. So how do you fit everything in? It sounds like you're doing so much. Like, how do you fit that into your life?
Like I said, you just make the time, I guess. I mean, as a hospitalist, I work like 2 to 3 days a week. So I still have the 4 days, right? As a graduate professor, you actually don't have to be in campus every day. So I go there like once a week and I do a lot of work on my own at home. And the rest of the days is for my aesthetics. And then, like I said, you make the time in the morning. I try to not take away the time with my family. I still go out a lot. And you kind of just want to make sure that your life is still balanced. And I just been doing that for years. That's kind of just norm for me at this point.
When you were an RN, what did you do as an RN? What was your role going way back?
I was a pediatric nurse. I've been doing pediatrics for years. So at some point, I did try to work per diem in adults just to see what adult world is like. But pediatrics has been what I've specialized through and through.
Okay. And did you always know you wanted to have multiple roles as a nurse, as advanced practice? Did you know that you would go in so many different directions?
Not really. It just kind of fell into place. So when I graduated from my master's, there was this opportunity of an ENT, which I went for my interview. I was hired. But then at the same time, the hospital that I worked for actually opened a pediatric program, and I was just hired right there. So I have those 2 roles immediately in my hands that I had to split my time. And then I went for my doctorate, and at that point, I was told that if I teach within 1 year of my graduation for my doctorate, they will forgive my loan.
Oh.
So that's when I said, I have to teach.
Yeah. That's big.
Yeah. So I graduated in 2016, and there was an opening in Mount St. Mary College in 2017. Mm-hmm. So it was perfect. So right there, I had to do that too. So, I didn't plan it. It just happens.
Yeah.
I think you also precept, right?
Oh, yeah.
Don't forget that. Oh, yeah. It's very important.
Well, that part of it. So I have students follow me in the pediatric unit that I worked in. Mm-hmm. Because it's such a difficult specialty to find a preceptor. And most of the time, I take students who last minute just don't have preceptors and they cannot graduate. At some point, I had 7 students.
That's a lot of students.
It was a lot. So I had to actually work extra so I can take students with me. So I had student every single day for like since January to May.
Wow.
Every day I am at work. But it was a lot, but I also know that I am helping the students.
Yeah.
Otherwise they can't graduate.
Right. Well, you're also an awesome teacher.
Yeah.
So
Thank
it's
you.
evident that you have a real passion and love for that.
Thank you. Yeah, I love teaching.
Yeah.
So it just, I think, comes very naturally to me. And, it's fun.
Yeah, that's one of the things I definitely appreciated about having you as one of my instructors is that you really truly wanted to engage us as students and really like ask us the pertinent questions and then also give us a lot of rationale, because a lot of times in school we're given so much information and we're just kind of like, trying to just remember things and trying to get things to kind of sink in. But you would give like very good examples and a lot of, real case studies and things that you were involved in that would kind of help, with our memory and help with our understanding just to get it on that deeper level. So like, I really appreciated that about you. And even like how, like there was one class we were in and you went into a whole thing on antibiotics
Yes.
and, the different classes and different generations of antibiotics where no one had done that before you had done that. And it was really, really great. It was a really impactful class that we had that evening with you. I don't know if you remember that, or you
Yes.
probably do that with every class, but it's so important.
I do now because I see the what's lacking in our practice. And I have really realized that when I precepted students. So when they come to me, that means you only have 1 semester left and you're out there on your own. And when I realized that they still lack the knowledge in antibiotics, and especially really what happened is that the labs, like reading labs, that was like lacking. So Dr. Eubing and I actually put together a course that we integrated in the program to help the students out. And that I think so far it's been great. So this course is called Advanced Diagnostics and Therapeutics. It teaches students how to read CBC, chemistry, coagulation panels, liver function tests to really tie these numbers in a clinical setting, like to a patient. So yeah, and then it also includes like reading x-rays and CAT scan and MRI and EKGs. So as a clinical school, we thought that was lacking. I think in your time, guys, you did not have it.
Nope.
And so we integrated that recently, and I'm so happy because I think it's very useful.
Yes.
Oh, that sounds
Yes.
very useful for
Yeah.
sure.
Absolutely.
Yeah.
Needed, very
Yeah.
needed.
Yeah, totally.
Yeah. I'm happy to hear that.
I was just gonna say that, like as an instructor, that I felt like you really, like you could tell that you cared about your students, and that you kind of understood what we were going through, because you would like, I remember specifically the antibiotics, and you would teach it, and then you'd kind of look at us and be like, "You totally didn't get that," and then you'd go through it again, So that I appreciate that. Yeah, you were like, "You do not get it."
Because sometimes it's easier to just keep saying it and saying it, but if you cannot connect it in a clinical setting, it's hard.
Yeah.
It sounds easy when I talk about it because I use it. I imagine patients on it.
Right.
But if you guys have not really encountered such, situation or clinical scenario, it's just hard to, connect sometimes. So sometimes you just have to explain multiple times.
Yeah.
So
Yeah, it's hard when you're in any program, I'm sure. You're getting a variety of instructors with different styles of instruction, and then you're going with preceptors who, we all talk about our preceptor and, our clinical instructor experiences, and sometimes they're wonderful and sometimes they're not so wonderful, and sometimes we're just I know I had one preceptor that I was just standing there like I couldn't even really touch the patients, and
wow.
you can't learn like that. I'm not going to learn it like that.
Exactly.
No matter what attitude I go into this situation with, I'm just not going to learn it. It's a very closed way of teaching from a clinical perspective. But, sometimes we're so desperate for preceptors that you just have to take what you can get and hope for the best.
Right. That's kind of unfortunate sometimes when I also get it because of the way healthcare at this point is driving the business. It's almost like a business where it's also affecting the preceptors. Like they have to have productivity, and if they can't meet this certain number, it affects them. And having a student, I should say, slows you down. But at some point, these students have to learn somewhere, and that's why I feel like as a preceptor, although it slows me down, that's something that I always think at the back of my head, that these students are going to be clinicians, and what they get from me today is what's going to mold them or build them as a clinician. So I have to do a great job teaching them. So it's not always like that in different, clinical setting or having a different preceptors. And it's just the reality, I guess.
Yeah.
Dr. Suderio, how would you describe your experience, like whether, it's in the hospital setting or in the office setting, or even in your aesthetics, as far as working kind of alongside with different providers, physicians specifically?
Okay. So the thing with my role is in the hospital is very autonomous. I am on my own. So like I would work overnight and I'm there. I'm the only pediatric provider. The good thing is I have very, very good backup. My attendings, if I need them, I can always call them or talk to them if necessary. Like I can't even remember having them to come in because I think the role that I've been doing it for so long that I think they just trust me that I'm doing the right thing or doing the job that I'm supposed to do. Mm-hmm. As far as the outpatient setting, I have a full support from my collaborating physician. Definitely another autonomous practice where I am on my own. If I need to talk to him, I'll talk to him. But I'm there on days that he's not even there. So I just run the practice on my own. As far as support from them, I think I am lucky that I am able to work with physicians who really support what we do as NPs. So I remembered an instant when a patient refused to see me, because that's kind of an obstacle that we go through as NPs. It's especially when I started way back when in 2010, when people are still like, who are you? You're the nurse, right? And I'm going to see the doctor, right? It's like, no. You're going to see me today, and this is what I'm going to do. So I've already, assessed the patient. I have made my diagnosis. I have made my plans for the management and everything. And they will still sit there and say, when is the doctor coming? So that was kind of hard in the beginning because there is no publicity as to what NPs do. Mm-hmm. There is no awareness as to the roles that we really do in the medical field. But, through the years, that has changed a lot because now everybody knows what we do. Mm-hmm. And, there is no resistance or hesitance from the patient. I mean, it's less and less at this point. So at one time, this patient insisted on seeing the physician in the office. That was my collaborating physician. And so I told the patient very nicely and respectfully that I said, I respect your decision. I don't want to waste your time. And I don't want you to waste my time because I have other patients that I have to see. And then when our physician heard about it, that the patient doesn't want to see me, he actually instructed the staff to tell the patient that he trusted my clinical judgments. That is why he hired me in the first place. And if the patient is not comfortable seeing me, he suggested that the patient go somewhere else. He actually refused to see the patient because, we work well together. And I thought that was such a testament of his support and confidence in me, and just to let me know that there is mutual respect in the practice.
That's amazing.
That's great. That's just amazing.
Yeah.
what would you say to like new nurse practitioners or just nurse practitioners in general, if that does happen to them, that if a patient, is expecting the doctor to come in and you're supposed to be seeing the patient, like what can they say to these patients who, I guess, don't understand your role or...
Okay. And just to be honest, so it's also an opportunity to really educate the public about our role. That's why when I go in, you go inside the room, see the patients, you really have to introduce yourself as the nurse practitioner. I will be your medical provider today. I'm going to examine you. I'm going to see what's going on. We can discuss together a treatment plan. If I am not quite sure about what treatment plan that is, I'm going to discuss this with my collaborating physician and see if there's anything else he would suggest. And if they say, you know what, I really just want to see the doctor. And you say, you know what, that's okay. It is your right to do that. How about, I'm going to call our staff to reschedule you, or, it's really okay. You have to give them the rights to choose what they want. But at the same time, most of the time what happens is after I talk to them that this is my role, this is what I do, I've been here for this long, and you can reschedule. Most of the time they don't want to reschedule. They're already sitting in the chair, just see me now, right? So I will end up examining them, doing everything. And they usually stick with me. Like, they don't even talk about seeing the doctor anymore, Yeah, really. And they were like, oh, I'm sorry about that. Like, I'm not familiar. It's like, and I always tell them, it's like, I totally understand. And you have to be compassionate about that. And you have to be very understanding, because I can't blame them, because if they're looking at a website and, everything that's being said there is about your collaborating physician and not about you, you can't really blame the patients. So you just have to be honest and be straightforward. And I always tell them, I don't want you to waste your time, but I don't want you to waste my time either. So it works.
I guess they're anxious too. They're a lot of times they're coming to the doctor for whatever reason, and they're just anxious, and maybe that's how it's coming out. And
absolutely.
They weren't expecting to see you. They were expecting to see a physician maybe that they know, or a physician that's associated with that practice.
Absolutely. And what you can tell them is like, how about we get started? And if you're not comfortable with, our plan today, you can make an appointment, or I'm going to discuss this with him. How about that? Like, and then they're very open to that. Like, there's always going to be special patients who are going to just make your hair white that day, and that's okay too. It's not going to be an easy road all the time.
Right.
There's gonna be challenges, and that's just part of life. Being being a nurse or a provider, it's all the same. You will always meet some hurdles, and you just have to deal with it in a professional manner.
Right. When you graduated from nurse practitioner school, what obstacles did you come across? Was it easy for you? What was the transition like?
To practice as
a nurse practitioner. Yeah, as a nurse practitioner. Yeah.
I guess the outpatient was more of a challenge, because, like I said, NP role wasn't really known then, and the doctor I work with is a specialist, like a well-known specialist. So when they come to me, they would be like, okay, what do you do here? When did you graduate? Can you imagine? I said, oh, I just graduated a month ago. So that was a challenge. But the thing is, if you're just being honest and you just go in there and you have to prepare too. You can't just go there not knowing what you're doing. You have to study. You have to study ahead of time. If this is ENT, I'm going to read about ENT. So when I go there and talk about it and talk about these different problems that the patient may have, and they can tell if you're knowledgeable or not. And that actually builds confidence and trust in the patient's side, that it's like, oh, she knows what she's talking about. And most of the time, that's how I present myself like I've done it 100 times. Although, hey, you're actually my first patient, but you just go there with confidence and making sure you're prepared. You can't just go in there to not prepared. So as far as my hospitalist role, that was actually an easier transition because I was already a nurse there in that floor. So I know the logistics of everything. I know the people. So when they opened that program, it was quite fast, and there's not a lot of us hospitalists. I was the only nurse practitioner. Everyone else are pediatricians. And they were like, oh, Elaine, by the way, you're scheduled to work these days next week. And that's it. I have no orientation, nothing. So, it worked out, I guess. I did not kill anyone. Like I said, I go there and I study. Mm-hmm. You have learned stuff in school, although it's not enough, but it's a good foundation. You have that common sense. You have critical thinking skills, and you just have to apply that. Your knowledge, like when I was looking at the different things that I wish I did as a student, it's like I wish when I studied, I would have studied knowing the very bottom of everything. Remember when I asked you in class why? Why? I always ask you why. Mm-hmm. Because I want you to know, I want to know the reason why things are done the way they are. Because that way you have the grasp of the whole concept. You're not memorizing.
Right.
Because if you're there's just so much to memorize, and it's not real knowledge.
Right.
But if you're understanding way down to the pathophysiology, you can go out there and just talk about things with so much confidence. So I always, when I read something, for example, when I first started, they say, oh, you're going to see a diabetic patient. I know how to take care of diabetics, but I still have to read. I have to read through things just to make sure that I'm able to review and, just refresh that knowledge before I go see the patient. And all of this comes with practice. Like now, things are really easy. I've been doing this for over 10 years. So it just builds that a lot of knowledge, like hone your skills and critical thinking skills.
It's very good.
That's great advice.
Yeah. And it's a lot. It's like be humble that we are going to learn something new every day. And that's just part of it. And it's okay not to know something because we cannot know everything, right? So if you don't know something, just know how to get the answer. You have to find the answer. And when there's things that I don't understand, I don't move on to the next. I have to find the answer before I move on. So I think that's like what I advise my students all the time, because if you're not understanding something, that really doesn't give you a whole confidence of what you're doing about that specific topic. Mm-hmm. Right? So.
Right. And it makes it hard to move on to the next piece of the puzzle.
Right. Exactly.
Without it. Yeah.
Exactly.
Did you have any issues with any of the nurses that you worked with as an RN? Because you became a nurse practitioner in the same place.
Right. That's a very good question. A lot of people actually ask me that. It's like, how is it like, working with your, co-nurses and now you are the hospitalist there. The awesome thing about where I work is that they were excited for me to be the hospitalist there. So I get their support. Like they are excited to work with me and I'm excited to work with them. I trust them as nurses. They've been like pediatric nurses forever. If I know that they're on the floor, I just know that my patients are going to be okay because they will know when to call me. So I didn't get that feeling of, disrespect. They always respected my input. But the thing is, I also include them in the plan of care. What do you think, guys? Like, we've worked together for so long that we have mutual respect.
Yeah, that's great to hear that.
That's why I love all my jobs. Because it just works well. Like, I cannot leave one of them. That's why I have to make 8 days instead of 7.
How'd you do that? That's great.
Yeah, right?
Yeah, I think that's the scariest part of, being a new nurse practitioner is feeling like you have to know everything, and obviously you don't know everything, and how to handle that when that situation comes up where you have a patient in front of you and you don't know like what to do. Like, that's the scariest.
And like I said, that's okay not to know, but you cannot not know everything. There's something that you know. And you put that together, whatever you know, put it together, what makes sense, and then always think patient safety. Whatever you do is patient safety all the way on the top, okay? Because if that's your priority, you will do the right thing.
Right.
Because if you don't know the answer, then you're thinking, okay, this is not safe for the patient. I have to know the answer. Who do I talk to? And again, be honest with the patient. Be honest, like not scare them that you don't know anything. Just say, listen, I haven't seen this situation before. I'm not quite familiar. Let me talk to my colleagues and see if they have seen this. And don't worry, we'll put a plan together just to make sure that we have a plan for you and that you will be safe going home. I always at least reassure my patients that way, because patient safety, even for them personally, they're worried about their health. So, but if you tell them that what I'm doing is to make sure that you're going to go home and you can sleep okay, knowing you will be safe. So both for parents or for adult patients, I always use that as my philosophy in caring for my patients.
That's awesome. That's awesome. I think you definitely, hit the nail on the head as far as that transparency and humility. And I think that actually builds trust with the patient, because they can easily pick up on, whether you have confidence in what you're saying.
Oh my
or not.
God, yes.
And so, so for you to say, listen, I don't know. And I think they see the human side of you and like, listen, you really care. This person is really caring about what's going on, because they're telling me they don't really understand, but they're going to find out, and they're going to be in my corner. They're for me. They're not trying to just brush me off and tell me something that I want to hear. But I think building that level of trust, and I think the patients appreciate that so much. So that's awesome.
Oh my God, they will respect you.
Yeah.
And they will respect you for that. Because if you make up stuff,
they
will know that too.
Oh, yeah.
Then, exactly. And it has really helped me grow as a practitioner. And it also gives you lessons too. It's like, oh my God, I just felt stupid today. And that's okay also to feel that way. It's like, oh my God, I hope I don't really appear so stupid in front of the patient. Well, there are days that you feel that way. And that's okay. And then you will build yourself into knowing whatever that you didn't know. And it's not going to happen again, because you will learn about that specific topic. Yeah.
I think too, Dr. Suderio is not, especially with like where I am, I'm in primary care, not necessarily always pushing medication because you don't know.
Right.
Because patients will sometimes they'll say, I'm so thankful you didn't just throw a medication at me. I already have enough that I'm taking,
Right.
And it's like, okay, let's figure this out. Let's see what we can do. Whether it's diagnostic testing or more conversation.
Right.
To figure out. Yeah.
Right.
And I think that's what sets us apart a bit. And I'm not saying that all MDs do that either, but I think, having a little bit more of an in-depth conversation, giving that level of time to kind of get a deeper overview and understanding of what might be going on a deeper level.
Right. Absolutely. There's a lot of hand holding. Like when I hold her hand still, I will have 90-year-old men or 100-year-old patients who sometimes they just come to the office even if they don't have problems because they're so lonely at home. I'm serious. It's like, I just saw you last week. It's like, I think my ears are hurting again.
Aww.
And all they want is for you to hold their hands. We would just be holding hands for 15 minutes and talking about things. And I like that a lot. There's, although we are nurse practitioners providing medical care, we will never be not a nurse. We'll always be nurses.
Right.
You know, you have that extra touch. And I like that a lot about us NPs, really.
Yeah, I do too.
Yeah, good point.
Talk about your aesthetics. How'd you get into aesthetics?
So I talked about ENT earlier, ENT allergy and plastics, because the surgeon that I work for actually is double certified. He's certified ENT, certified facial plastic surgeon. So I was his NP there. And initially, you know, as a new nurse practitioner, I'll never touch plastics because it's not real medicine. I'm going to see my ENT patients. I'm going to see my allergy. I'm going to diagnose, you know, write prescriptions and all that. And I never really turned my head into the plastic side of the practice. But eventually, I was kind of forced to get into it because there was no help in that side. I got really busy. So I just jumped in. And I realized that, you know, what I thought about plastics is really not what it was, you know. There's so much to it. I thought that going to plastics is superficial because people just wants to be pretty, but there's so much more to it. It's very personal. Sometimes people don't go out there because of how they look, or, you know, something happened and they need help. And to be able to help them, you know, make themselves comfortable again, it was great. And I am an artist. That's just me. I paint a lot. And being in aesthetics actually put my love for art and science together. You have to know science. You have to know the in-depth anatomy of your face before you can just inject. Okay? Because a little bit if you're off a little bit on the muscle that you're injecting, it can cause, for example, you just inject somewhere in your eyebrows or forehead and you're not injecting the right muscle, you can cause ptosis. And if you don't know the anatomy in depth when you do injectables, you can cause blindness. So it's not just injecting, it's not just making yourself pretty, but just knowing a lot of science to it and putting my art. Because, for example, a patient comes to you, they went through, medical issues like cancer, they lost a lot of weight. I actually have a real patient. She came to me, she said, I have not seen my family in a while because I really don't want them to see me like this. I lost a lot of weight. I'm just all saggy. I just look very sick, and I know that it will worry them, and I just don't feel good about myself going there. So we did something. We injected fillers. I used the product Juvederm. There's different products out there. And then filled where she thought has a lot of volume loss. I did neurotoxins. I injected Botox just to help with the lines, open up her eyes a little bit because it was really droopy. And then after I did that, she was like, oh my God, she started crying. Because it's like, I cannot go back to where I was before. It's like, I have to say goodbye because I took photos. Like, I have to say goodbye to that face. It's like, now I can actually attend my family reunion. And it felt good because then it's not just plastics, superficial.
Right.
There's so much more to it. So I enjoy it a lot, thoroughly, because it's really if you're playing Play-Doh and you're sculpting something, it's kind of like that, but more complicated than a Play-Doh. Okay.
It's just what I'm hearing is just their quality of life is that much more enhanced because of that, that element of care that you're putting into.
Absolutely.
Yeah.
Absolutely. So when patients come to me and say, what can you do for me? And I always ask them a question again, what bothers you? It's like, why are you here? Because I might see a lot of stuff, but if it doesn't bother you, don't do anything about it.
Right.
Yeah.
But what bothers you? Mm-hmm. So if this what bothers you, then let's work into it. Because then once you see the mirror again, that thing that bothers you is not there anymore, then you're happy.
Right.
Because if you just let me do what I want, it might mean that things that you don't want. So I have different approaches as to, dealing with patients like that. Sometimes they come and they don't really know what they want to do. I just look tired, help. I just want to
Not look tired.
I just want to go out there and look like I'm refreshed. I was like, okay, let's do this. So it's so much fun. And as far as starting my business with teaching, it just comes naturally because I'm a professor. And I have a lot of students. You know that class you have, guys, the role of NP?
Mm-hmm.
I get invited to that a lot to just talk about my experience. And then when I tell them I teach, I do this, and I will get a lot of emails like, hey, I'm interested in doing this. Can you teach? Then I have gazillion emails. I was like, what am I going to do with them? So I was like, oh, I'm just going to start training people.
There you go.
Good for you.
Yeah. So then I started because most of the time my clients, like the students I'm teaching, are really my students from St. Mary College.
Yeah.
And because they ask questions and I was like, where am I sending them to? It's like, there's really no place here to do that. And I know I can make a more quality teaching than just sending them to a training center where there's going to be 30 to 50 students. They will do a blanket, teaching of probably the didactic. But for me, hands-on is very important. Hands-on is when you build your confidence.
Right.
So I limit my students to 4, maybe 6, but the most. But if I have only 4 students I can really focus on, then they will have time to really do a hands-on and make sure that they're comfortable. So it kind of like putting all my specialties together, teaching and the aesthetics and putting them together. And I like seeing my students thrive out there and grow and, have options for themselves.
Sure.
That's great.
And if they don't want to use it for something else, they can just inject themselves.
Yeah.
That's expensive.
Or inject each other.
Yeah. I like that.
Exactly. No, really, it's more of just expanding your options out there.
So you were trained by the physician you worked with at ENT, or you took a course training?
No, I was just there. I've been there for 11 years.
Oh, okay.
And there's always training. There's always reps from different companies who come, and he's really, really good at training us. He always gets what's new, what's the latest and the brightest, and we get it. So I'm really lucky because I was able to get the trainings that I need. And recently, I've been also asked by Allergan, that's the company that makes Botox, to go to their accounts and train providers.
Wow.
So recently I went to a practice down south. An anesthesiologist and an NP who opened a practice together, and I taught them how to do injectables.
Wow.
And then they actually booked another training for me to go back there in a few weeks to do the same.
Good for you. That's awesome.
Yeah, I like it. I like teaching.
Yeah, that's great.
How is the process of setting up a business for you? Did you know how to do that, or did you have somebody guide you in that, or
I just make it up as it goes? No, really. You have to do your own readings. It's really easy, actually. It's very easy. You have to get a license from New York State, make sure you're legal. That's important. And after a while, I was just too busy that I have a friend who is business savvy and she has her own business. I just let her do it. And she just did all my paperwork. It's just too much work for me at that point to get into it. But it's like a one-day thing, really.
Yeah. Is she your partner, or she just
No, she is my training coordinator now. Okay. It's like she does everything for my trainings. Like if I have a lot of emails, I don't answer emails anymore. I just don't have time. Yeah. And she takes care of that. So I hired her as my coordinator, training coordinator.
That's great.
Yeah.
Yeah, we talk on our podcast about options in business for nurses and for nurse practitioners to kind of make their license work for them and know that they can do that. They can go out on their own and they can do these things. So
right, it's always good to talk to a lawyer just to make sure that you're doing things right.
Yeah.
Because you don't want to get into something and then it wasn't right and it will come back to you.
Yeah.
And, take care of a problem. So if anything, if you want to go into business, if you're not familiar with it, make sure you run everything through a lawyer so that, you do things right.
Yeah. And do you have to have insurance for your business above and beyond your malpractice?
Absolutely.
Yeah. Okay.
You have to.
I figured.
Yeah. I went to, because I had NSO as a nurse before, and they have different options there. So I kind of just used them for my business.
Okay.
Definitely different rate.
Yeah, for sure. No, but it's good to know where to go. Yeah, that's a good direction.
But there are other options in there too.
Yeah.
So I have other friends who use different companies at a lesser price, but be careful of that too. If you think the price is half as the, ones that are well known, you just have to look at the fine prints. Make sure you're really covered.
Yeah.
For like every little thing that you'll do and all the complications that goes along with injecting. Because it's not just, I just want to warn people about injecting. It's just not injecting. There's a lot of complications. You can, cause tissue necrosis that requires like a plastic surgeon's hands to actually do an actual surgery. You have to remove the tissue. And the biggest thing is anywhere you inject in your face, if you vaso-occlude, meaning you occlude a vessel, especially an artery, it can cause within 24 hours blindness. So I don't want to scare people, but actually I want you to be scared because I don't want people to just think that it's just injecting.
Right.
You have, again, let's go back to patient safety. So you have to put it out there. You make sure that you're really well prepared before you start injecting people.
So I'm a nurse practitioner and I want to sign up for your class. What do I have to have in place? Do I have to have anything?
No, you just want to make sure you have a current license, that you're actually, licensed to practice in New York. That's really it. Like you get your training, you get your certificate of completion of the training. We're actually applying for accreditations. You get CME credits. And once you have that, just because you have a paper also does not mean you're ready.
Right.
Right? So I always advise new injectors to either continue shadowing somebody just for a day or two, just to look, just to get that confidence ready, and not necessarily make money in the beginning. You suck up the
cost,
loss,
the cost. Yeah, not even loss. You just have to, charge people at cost. So you don't necessarily lose money, but it's just your time and your talent. You tell them, listen, can you just pay for the product? I'll inject you. I'm honestly just practicing. I just started. You have to be honest with that too.
Right.
Because if something goes wrong, they know they paid for the product and there's a potential complication that goes along with it.
Yeah.
So I always, to build up, because it's expensive. This is not cheap stuff. So people always like something that they can get at a lesser price. And people are willing to do that, especially your friends who are going to be understanding if something goes wrong. And then each time you do a hands-on, it actually makes you feel more confident in injecting.
That's great. And now you teach 2 classes, is that correct?
So I have different times actually. So I have the one that is very popular for newbies, anybody who has not injected yet, is the basic anatomy and basic Botox injection. So that's a separate one where people say, you know what, I just don't want to do anything yet. I just want to do Botox. So that's for them. And then there's also basic fillers, where if you're already comfortable with your Botox, then I want to move on with my fillers. Okay? So I also have ones who have worked somewhere where they have observed a lot of this and they just want to get the Botox and filler together in one day. I have that combo as well, just basic. And then I move on to advanced injections,
Like if somebody who's been injecting already is like, you know what, I want to learn how to do platysmal bands, like the neck, like when your neck is hanging and you want to inject that. So I can teach you.
You can see it right here.
So I have that combos also where it's like, the training today is for platysmal band and for gummy smile. Meaning, when you smile, the gums show up, so you can inject areas. So those are advanced techniques. You can also do advanced techniques in like under your eyes, stuff like that are not included in the basic. There's a lot to it.
Yeah.
And there's also other procedures like PRP in the head where you have hair loss or hair thinning. You can inject your own plasma. I do trainings for that too. And microneedling, those are the easier, like very easy procedures.
And you do all these in your practice also. So this is your practice.
Yes.
Yeah.
Yes.
So it's your practice and your teaching.
Mm-hmm. Yes.
That's great.
Wow.
Exactly.
It's awesome.
Thank you.
Yeah. It's
I
really
think
great.
it's interesting, really keep me on my toes. And I really love just sharing my knowledge and skills to everybody. Say, Elaine, you're teaching everyone. You cannot make it, like now everybody's doing it. You don't have clients anymore. So I was like, that's great. That means we're sharing. Like it's going to be, and there's nothing wrong with it.
Yeah, that's such a great attitude, actually.
Yeah, it is. It is. And there's always, there'll be enough to go around.
Exactly. So I'm not worried.
Is this something that you have to be recertified for every so often?
No, you don't have to be recertified, but it's always good to get, certified on what's new out there. There's always going to be new techniques. And the good thing about this is once you're in the business, there's a lot of webinars. There's a lot of companies who just wants to offer free, trainings as well. And just to make sure that we're up to date with what's new. Like It used to be that there's, default dosing, for example, for neurotoxin in forehead. Now they're changing that. So there's going to be always something new, just like anywhere else in the medical field.
Right. So your wealth of knowledge is incredible and you do so many things. Is there anything specifically that you wish that you knew as a student or a new nurse practitioner that you know now that you wish you knew then?
Are you asking me what should I have known when I grow up? I'm just kidding.
Pretty much, yeah. Exactly.
What I should have known when I didn't know, I should have known it.
Yeah, exactly.
I'm not really sure. Because it's a long time ago. It's almost like being a student has been a long time ago. In fact, the thing is, I'm a student now again.
Yeah.
I'm doing my...
That's right.
I'm doing my psych.
Yes.
So I'm a student again. So to answer your question, I think, like I said earlier, actually knowing concepts to the bottom of it, not just the surface.
Mm-hmm.
I think I know so much now.
Mm-hmm.
But as a student, I really did not understand it. I felt like I went through school not really understanding the real foundation of things. Mm-hmm. And I wish I did that as a student. I kind of built it up as I went on with my experiences. But as a student, I wish I did that and started as a student doing that. Mm-hmm. And also, I think there's also things that we do now that's not present when I was a student, like different apps, We have a lot of resources at the tip of our fingertips now that were not available then. So I think, bottom line is I think more of really knowing things, the in-depth of things. And I think I cannot emphasize that enough to people because, like I said, you can just know things on the surface, but not really understanding why. That's why I love my word why. You'll never grasp it.
Wow. And do you have, who's your mentor?
I have many. Let's see. I don't know if you remember Dr. Priscilla Sager.
Yes.
She's my mentor in the academe arena. She was amazing. She's a very dedicated, oh my God, if there's a model teacher, it's her. So she's almost like my mom. She's like my whip. Did you do this? Did you do that? Did you write the way? You really have to follow the rules and da da da. So she was great, helping me get through the academe world, because that's not really what I went to school for. I'm more of a clinician than an educator. So, but there's ways to be a better educator, because not all clinicians can be educator.
Right.
Is what I'm trying to say. You know.
So true.
So you can be a clinician and a great educator, and that's great. So because I became an educator, because I have a great clinical background, I needed that support and guidance from somebody who's just pure educator. So Dr. Sager provided that to me, and I'm very lucky. As far as my pediatric clinicals, I would say Dr. Sung and Dr. Fenner. They are like the best, you know. They're just like so supportive. They just so supportive of nurse practitioners. They're so willing to teach. And I think me as a practitioner now, it's because of them. Dr. Song gives me a lot of independence in my practice, but at the same time, give me a lot of lessons that I need to learn to become where I am now. And she's never condescending. She's just all supportive and just a great mentor in general. And who else? And of course, I cannot forget Dr. Rubenstein in the plastics world. I think he's the best in that field. And again, I feel very lucky that I happen to work there, because he really is the best in my area in Newburgh. That's where we practice. And just up to date with everything, you know, very perfectionist. And you want somebody who is a perfectionist in plastics.
Yeah.
So I think, you know, my stars were aligned and put me where I should be to become who I am as a clinician.
Regarding the aesthetics area, where do you see that whole realm of practice going? Because it just seems like I know it's been there, but it just seems like it's just kind of been growing exponentially. You know, where do you see things advancing, or where do you think the future of aesthetics and injectables, and maybe where do you see yourself going with it?
Well, it's going to continue to do that, really. The thing is, there's going to be a lot of people who will need it or want it, not necessarily need, but want.
Yeah.
You know, we're aging. That's the thing. We can't stop that. And there's always going to be a need for that. And it's already, I think, there's just so many places that do it, but it doesn't mean that it's just for them. You know, you have to make your name. You have to make it out there and start somewhere and find your niche. And I think it will just continue to grow. And there's always advances in that field that I think is really interesting, that people should not sway away from it if it's not something that they love to do, you know. And again, there's so much art to it, and you really have to do it for the right reasons. I think that's the thing. You can't do it just for money, because you'll never succeed, because you have to be dedicated. It's not easy. Like, you know, people go in there paying money from their out of pocket. It's not insurance, so it's more painful, right? Doing it. So if you don't do the right thing, they will always come back to you and say, you know what, fix this. So it's very stressful. So I think just getting yourself ready and prepared and setting expectations to clients is really important also. But in my end, so I'm doing this. It's really interesting because I actually have meetings with a group of amazing people down south where we will probably open a big place and expand.
Wow,
So,
that's great.
Yeah, more to come. I don't know yet. See what happens during our meeting, but it looks promising.
That's great.
So you do so much already.
You look tired asking me a question.
You're making me very tired. But how did you decide to go back to school? And explain what you're going back to school for, and how are you going to fit that into like your life?
Oh my God. Yeah. The thing is, working in pediatrics, I mean, I'm very passionate about what I do with pediatrics. That's why, even though, to be honest, that is probably my lowest paying job, and the schedule really is not family friendly, I'm still there because I love my pediatric patients. I also see the need where psych is just not supported. Like we have children who will be in the emergency room waiting for placement for days. Like during COVID, we would see like 8 years old, 7 years old who has anxiety and depression, and it's just so sad. And they have no place to go, and there's just no providers in the area.
There are no providers. Yep.
There's just none. And where are these patients gonna go? Now, it's not like I have more time to take care of them, but I feel like if at least I am armed with that knowledge and skills where I can help them transition or whatever that might give me. So, and like I said, I like learning. I actually like being a student more than a teacher. So I like, wearing my backpack and going to school. And so when you ask about time, so remember I said, if you used to wake up at 6 o'clock in the morning because you have to get ready to work. Well, guess what? Since I started going to school, I've been waking up at 4:30 in the morning.
Wow.
Because I have to read my materials. I have to be a good student, especially that my classmates are actually my former students.
Right.
So
right.
I had to make sure I do well in class. And yeah, so you make time.
Right.
In life, I can say to you with everything I do, like right now, there's just no way I can fit in school. But I do because I make the time.
You're amazing. You're absolutely amazing.
You are amazing.
Oh, thank you.
And we're so fortunate to have known you, been educated by you, and to continue to have a relationship with you beyond our schooling.
Thank you. What you guys are doing right now is also amazing. I'm just so proud. I'm like, it's almost like these are my babies. And they're just amazing.
Yes.
Isn't that funny?
Thanks.
Wow.
It's really nice.
But thank you. And I hope to see you somewhere at some point.
Yep.
Our roads will cross again.
Absolutely.
Yes,
definitely.
Hopefully soon. You're a true inspiration. Thank you so much.
You're welcome.
Thank you for listening. If you like what you're hearing, please subscribe to us and give us 5 stars.
If you have any ideas or comments, please message us at 4npspodcast@gmail.com.
Please follow us on Instagram, Facebook, and Twitter at 4NPs Podcast. That's the number 4NPS Podcast. Subscribe to us wherever you get your podcast and go to our website at 4npspodcast.com for episode transcripts, resources, and more information about us.
Thanks so much for joining us today. I hope you feel inspired by this interview with Dr. Elaine Suderio. Please join us next week when we interview Beverly Lang. Beverly is the Executive Director of the Nurse Practitioner Association of Maryland. Beverly has 30 years of nursing experience to share with us. Until then, have a great week.
The information in this podcast is for educational purposes only and should not be used in substitute for professional care by a medical provider. The information in this podcast does not represent medical or other professional advice or services. The thoughts and opinions presented on the 4NPs podcast are of the hosts and guests and do not represent those of their employers.